Hi, good morning everyone, and welcome to our first Facebook live session here at COH on PPE. Thank you for joining us. I'm Liam Brennan. I'm a Deputy Medical Director here at COH, and I'm joined today by our Chief Nurse, Lorraine Szeremeta, Sue Broster, who's a fellow Deputy Medical Director, and Chris Moody, who is our lead infection control nurse for the COVID-19 outbreak. The purpose of today's session is to give you an opportunity to ask any questions you have about PPE. We know PPE remains a major concern for colleagues across our hospitals, and we want to take this opportunity to clarify what our situation is and also provide reassurance where we can for many of you who we know are worried about your safety and the safety of your families. We've received a number of questions ahead of time from staff who have not been able to join us. Unfortunately, we won't be able to answer every question received. However, we'll aim to get through as many as possible within the next hour. This recording will be made available to colleagues after the session. If you're on Trust Wi-Fi, please switch over to 3G and 4G. I'll now hand over to Lorraine to provide an overview of our current PPE situation. Lorraine, thanks.
Thanks, Liam. Morning, everyone. I will start with just a bit of a summary and then look to my colleagues to join in with anything that I might have missed. I think it's important to say that, to start with, that we set our scenarios on a PPE and the correct PPE usage based on expert advice and guidance from both national and local experts. So the scenarios that you see in practice, we spent a long time developing them, looking at the PHE guidance as well as the experts within this room and elsewhere. We review our PPE stock levels on a daily basis in a PPE bronze meeting. That's also reviewed in the command and control structure within the organisation currently. We do have adequate supplies of PPE in the organisation. This is challenging for us, and many of you would have seen the national coverage particularly around gowns at the weekend. It is challenging and remains challenging, and we do have limited control over what comes into the organisation on a daily basis. But we are working incredibly hard, and our procurement teams have been fantastic at sourcing different supplies from outside of what would be a normal framework. We've also had a huge amount of donations made to the organisation, and they're currently being stored off-site and are being reviewed clinically. And as I say, we are procuring outside of what is a standard supply chain and also using local manufacturing. So we were seeing that some visors have been made by a local manufacturer that's been brought into us. We know that we have areas of supply that will be impacted over the next few weeks and are currently being impacted, such as the gowns and potentially some FFP3 masks and theatre caps. But as I say, we're reviewing that on a daily basis, and we do have adequate supplies of PPE in the organisation. I don't know if there's anything my colleagues want to add that I might have missed.
No, I think that's a good summary, Lorraine. Yeah. I think that the supply chain provides most of our needs, but we have limited control over the volumes and the type of PPE that we receive. We do work incredibly hard. Our procurement team, just to reiterate, are doing a fantastic job to procure outside of the supply chain and to engage with local local people who are donating to the trust and also to local industry to help supplement our stock. And we will continue to do that to keep our staff safe.
Yeah.
So thank you very much for that, Lorraine. Should we now start turning to some of the questions that we've already received? And the first one I was going to ask Sue, if you could help us with, is so what are we doing about the scrub shortage? We've put a lot of comms out and having had issues with the amount of scrubs we've got available for our staff. Can you give us an overview of where we are with that, Sue?
Yeah, so I mean, we recognise that scrubs are absolutely critical for a number of working areas, and we've increased the areas that need to wear scrubs in line with the scenarios to keep staff safe. So In light of that, we've ordered around 12,000 additional scrubs, of which many of those have already arrived into the Trust. And you'll be seeing that there's different colours already as you walk around the Trust, people wearing different coloured scrubs, which reflects that. We're also accepting donations, and the details for scrub donations will be on the website later today. To try and increase the availability as well as the supply coming into the Trust, we're also moved the washing of scrubs in-house, so there's an increased turnaround time, so the scrubs are washed and returned more quickly, so they're more available for staff. But it's also really important that staff who have scrubs return them at the end of their shift, so there is the opportunity to wash them, so they are available for the next staff who are coming on shift. And what we have seen is there's been a reduction in some of those scrubs coming back into the wash. So if I could just encourage those who have them to feel confident to put them in the wash, and then there will be enough scrubs for everybody, because we've done a lot of work to increase the amount of scrubs that are in the organisation. And if we use them and wash them and return them, then everybody who needs them will have the scrubs that they need to wear to work.
Thank you for that, Sue. I think it might also be worth mentioning that if you have your own personal scrubs, that's okay to use those, but you will need to take responsibility for making sure they're laundered appropriately. We put guidance on the COVID bulletin yesterday about that. Make sure they are taken home, laundered separate from other laundry items at 60 degrees centigrade to make sure that they are clean and safe to use the next day. Okay, so should we move on to the next one, which Chris, I was going to ask you to help us with, which is the question comes from staff members working on a COVID positive ward. Should staff be wearing an FFP3 mask all the time when they are patient facing on a COVID-19 ward and engage with some aerosol generating procedures?
So actually there's two parts to this question, Liam, and I think it's really good that you've raised this one. It's something that we get asked quite regularly when we're out and about on the wards. So if you're working with your patients and you're on a COVID positive ward and the patient may cough because you're within that metre frame, then it's your blue surgical mask, your water repellent surgical mask and your goggles and your visor is absolutely fine. It will protect you from the droplets that come out when a patient coughs. So a patient will cough and it's not an aerosol generating procedure, and I think that's the defining thing. So a droplet will come out of the patient and it will fall to the floor. So the fact that you're wearing something that's covering your mouth, your face, and is liquid proof, and then you've got that protection for your eyes, that's absolutely fine. But you're quite right, for an aerosol generating procedure, that is when we do ask you to wear the FFP3 mask. That is giving you added protection for actually making sure that those droplets that then come out into the air and are not settling straight away, that you've got that protection for it. Does that make sense?
No, it does. So thank you for that. And if people are unsure what an aerosol generating procedure is, Chris, how would they find that out?
There is a list on the COVID website, public health guidance is there as well, and we're constantly making sure that we're looking at the public health guidelines and updating accordingly to what we as a trust need to be doing.
Okay, so thank you for that, Chris. Another question coming from the same person who submitted this one. It says around the use of FFP3 masks, and when you're working close to the patient, particularly around their airway, around the head and neck area in particular, and around their mouth and nose. And they are specifically around, is normal mouth suction considered an aerosol generating procedure?
That's a good question, Liam, because we know that suctioning, deep suctioning can be an aerosol generating procedure, but normal suctioning is not. You're just going into the mouth area, removing what you need to, and you're not aerosol those contents out into the atmosphere. Okay.
And again, if any staff are unsure before they engage it, they can ask for advice.
Absolutely.
And get that advice from yourself or one of your team to help with that.
Absolutely.
Okay, so that's clear. So thank you for that. So the next one I'd like to raise then is maybe Lorraine, you could help us with this one. Please could you advise on the situation where staff are providing their own PPE, please?
Okay, I think it's important just to reiterate that we have enough PPE supply in the organisation. So we're not expecting any of our staff to provide their own PPE. We are taking advice on staff bringing in their own PPE and using that within the organisation and we hope to issue some guidance on that within the next day or so.
Okay, that's really clear. Lorraine, thank you for that. So let's move on then. So the next question is, what steps are we taking as an organisation to share any surplus of PPE that we may have with other healthcare providers? Sue, would you like to help us with that?
Yeah, no, I can talk through that. So, I mean, I think the principle is that mutual aid is key, and there's lots of discussions between organisations, not just on the biomedical campus, but especially on the biomedical campus between us and Papworth, particularly on a daily basis around stock supply. But that's also something that's shared more widely across the east of England about who has what and who needs what. So we are working very closely at a regional level and also at a local level to look at what stock we have, and other hospitals are also looking at what stock they have and where we might need to share that. But that's done on a daily basis and on a case-by-case basis. So there's not an absolute that we would always provide or not, and vice versa for any other trust. We're all looking at our own internal stock every day, and it's very variable because of the push supply coming in. We don't always know what we have. So making these decisions well in advance is extremely difficult because of the model which says it's a just-in-time model. So you get your stock just in time, and at that point we would always make an assessment, and a careful one that says prioritising mutual aid, but also balancing that against the absolute need to make sure our staff are safe.
Absolutely.
So we wouldn't compromise our own staff. We're always thinking about how do we keep our own staff safe, but recognising we also have a responsibility to staff and patients who work in the broader NHS.
And I think it would be fair to say, Lorraine, isn't it, that we're working closely with Papworth in that respect. People will be very interested to know we're now closely aligned, we're on the same campus, and we have done that and been able to provide really invaluable support to each other over the past few weeks on occasions when we've had stock levels that have been a problem for us. Mutual aid.
There's lots of examples of sharing between us and Papworth. You know, surgical mask gowns. Recognising that each of those decisions are made looking at the whole picture and very much on a day-by-day basis. So.
Okay, the next one asks about theatre caps that don't fit some people with their hair up. Not a problem that I have. And what can we do to improve that situation? Theatre cap supplies have been an issue for us, from today we have got a supply of transparent theatre shower caps that have arrived in to bolster that stock, and we'll be using those in the scenario 1 and 2 areas and keeping conventional theatre caps for the operating theatres. They are elasticated, so should overcome some of the problems that colleagues have had if they've got long hair or hair that's kept up, so they should be able to conceal that and secure it more easily. So that's something starting from today. And then the next question. Sorry, please, Lorraine.
Just to say that's a perfect example of where we've had to look to alternative supplies and think outside of the box. So we were struggling, weren't we, almost daily on the number of theatre caps that we had, which was impacting on theatres being able to run. So actually we've had to look at a different alternative, and you know, shower caps may sound a bit weird, but that's what we needed to do.
So we look for safe alternatives, pragmatic solutions to maintain safety and the standards that we want to maintain for you as frontline workers.
And they work very well. I put one
on. Right, Christine's nodding, but we're okay then. So the next question I'll take, I think, which is I'm working outside the hospital. What PPE and what precautions should I be taking? I think, just looking at colleagues around the room, I think we'd all agree that same as you would be if you're working inside the hospital, if you're coming within 2 metres of a patient, you should be wearing a face mask. If you're having direct patient contact, then you should be wearing disposable plastic apron and gloves. And then, according to a risk assessment, you may need to consider using eye protection as well. Chris, do you think would that be fair to say? Anything you'd like to add?
I think that's absolutely perfect, Liam, and it is about the risk assessment and being knowing the person that you're involved with and making sure that your PPE matches that. And I think, you know, as long as we've got our mask on and we're doing what we're being asked to do from our public health guidance, I think we're doing everything we can that's safe for yourself in that situation.
Okay.
Can I just add that?
Please, Lorraine. Please, sorry, Sue.
I think it's really important to say that, you know, it's important we look after our staff who work outside the hospital as much as it
Absolutely.
is the staff we work in the hospital.
Yeah.
So everybody is a priority for us, and making sure we maintain safety for all staff groups, those who are in the community who are working under the auspices of the organisation but outside of the acute setting, I think is really important. So if there is any questions, then please come back to us on that, because we would want to make sure that's fully supported.
And I think it'd be worth just adding that also applies to any of our staff who are having to work off-site to provide care for patients in the independent hospitals
Yes.
that are joining us in
Yeah.
partnership during the COVID emergency. That's working at the Spire Hospital and the Nuffield Hospitals locally.
And actually we're sharing our, again, around mutual aid, we're sharing
Indeed.
our resources with them to make sure, you know,
Working to the same
that
standards.
same standard for staff who are working there as are working in the trust here, and I think that's really important.
Okay, so the next question, Lorraine, I'd like you to help us with, please, which is, the question is, I've been advised to use PPE supplies from the hospital, but there is reluctance to supply me as they only have enough for CUA staff. Can I be supplied with the necessary PPE if required?
I think the simple answer is yes, of course. If the same as protecting our staff that are working in the community, people that are working in the hospital that are being expected to care for patients and whatever their role, should have access to appropriate PPE. The guidance that we have developed, the scenarios that we've worked up, are neither role or employer dependent. So absolutely yes, they should have access.
And I think maybe if there are any MediRest colleagues online this morning, I think we'd want to reassure them that you're absolutely part of this whole team that
Absolutely,
are responding
yeah.
to this crisis,
Yeah.
and that you have exactly the same rights and needs for PPE
Yeah,
according to the environment in which you're working, and we will ensure that you get that the same as of any of our clinical staff. I think, Lorraine, I'm sure you would
really,
support that.
Absolutely. And if there's a need for any additional training, then Christine and
Yeah.
the infection control team will absolutely provide that.
Thank you for that. So Chris, can you help us with this one? Is scenario 1 PPE enough, appropriate, safe to look after ward-based COVID patients in a red ward or amber ward?
Okay, so everything we're working towards is with the national guidance, and obviously we constantly review that in line with what comes out from the public health themselves. So, as I said before, the fact that a scenario 1 is your fluid-resistant mask, your goggles or your visor, your theatre cap, aprons and gloves. This is doing everything we can to protect you as our staff members by helping protect you from those droplets as they come out from a patient if they cough while you're with them. So this will cover everything that you need to do, and just all that I ask is please, please, please follow the steps when you take off your PPE, and make sure that you gel your hands in between or wash your hands, and that will also help any to pick up anything that you may have got on your skin at that point of dealing with your patient, and it will get rid of those organisms at that point for you. Okay.
I think sometimes it can get lost that it's all about the PPE.
Yeah.
It's also as much about doing scrupulous hand hygiene.
Absolutely.
Every time you
Absolutely.
come into patient contact, removing any item of PPE as well,
Or I would
or
suggest
before you put it on.
absolutely just take your time. This is not a rush. You know, keep yourself safe by doing it in a methodical manner, which it shows you on the posters, and follow the steps, and then follow the steps again when you take it off. And if you need help in doing your PPE, please ask someone. It's very good to buddy up and have that help, and just check that have you got everything on correctly.
Yeah.
Okay.
Thank you for that.
Ian, can I also just take the opportunity to say that we're very clear that if any member of our staff feel that they are unsafe with their PPE, so if they've not applied it properly or they haven't got the supply that they think they need, that we encourage them to raise that concern with their immediate line manager or call for help, and that might be either Christine or the, if it's a nursing member of staff, the matron or the head of nursing or myself even, we ask people not to go into an area if they feel
absolutely.
unsafe, and that's very clear, and there will be no repercussions to that. That's just that we want to make sure that our staff are safe.
Absolutely.
Thank you for that. So Lorraine, one for you. Can you explain how, I think this is really about how clinical areas access PPE?
So this week we've actually just started a push system for our PPE. So Christine and the team and members of PPE Bronze Group have worked really hard identifying the different different scenarios in different wards, and have worked with the ward teams to identify, and our procurement colleagues, to look at how much supply will be needed in a 24-hour period. And we issued guidance on that earlier this week, and we are piloting that currently. So we had some reports back yesterday in PPE Bronze where, okay, there's an area maybe getting too much PPE, so how do we look at that numbers and reduce it? And some areas that haven't received the PPE. So again, we're trialling this to make sure that every day there's a push supply out into the clinical areas that need the different types of PPE.
I think it's important to emphasise this is work in progress. We'll refine it. We want to make sure that we smooth out the supply so that we don't have peaks and troughs. Really important that we keep enough in the clinical areas for their immediate needs. Keeping large amounts of stock, I think it's, we've talked about this a lot, we can end up with the toilet roll situation, where we can have too many put away in cupboards, and that has the knock-on effect that means we have less for areas, then we can generate shortages where there isn't necessarily a real shortage, but we generate a shortage because we have too much stock in some areas compared to others.
Yeah, absolutely.
So if we move on then to the next question, and then after that we'll be taking some questions that have come through the Facebook Live system. Is there a way we can avoid using excessive use of PPE? And the question asked about testing asymptomatic patients who are planned to or likely to go to theatre, or by testing women before they come in for delivery, for example, and talking about how could that help us with that supply issue for PPE. Sue, could you help us with that one?
Yeah, so I think this issue is all about, are we using the safe and appropriate PPE? And the decisions that we've made in the Trust at the moment are all based on the most up-to-date evidence from PHE, from the Royal Colleges, from other specialty expert bodies, and it remains under constant review. So what we're doing now is based on what is best evidence for now. But we're looking at that constantly, and we're very aware what we might be doing in 3 months, 6 months, even 12 months' time may be very different based on what we've learned and what we know now about the virus. But for the moment, all the decisions that we've made are to keep staff safe, and that remains our priority. So for the moment, there's no immediate change to that, but we're keeping that under constant review.
Thank you. Any other comments from that, from around the table? Okay, thank you. So there are some of the questions that we've already received. We'll now move on, and Sarah Roberts from our comms team is going to pick up some of the questions coming through that you sent through live, and we'll do our best to answer those for you.
Excellent. So thank you for sending questions through. So the first one to you is, what's the view of people wearing PPE around the Trust, including eating areas?
Okay, Lorraine, would you like to take that one?
Well, I think we've been clear that you should be donning and doffing appropriately in your clinical area. So you shouldn't be wearing PPE outside of your clinical areas. So we are aware that we have seen some people, for example, walking around with lid caps and masks on. We have tried to talk to those individuals, and Christine, you had many conversations. We wouldn't expect that people are wearing PPE outside of the clinical area, certainly not in eating areas, etc. Of course, we do have PPE if patients are being transferred, which is slightly different, and there's guidance on that within the on the COVID page. But no, we wouldn't expect to see people in PPE outside of clinical areas.
Can I just
Please, Chris.
Yeah, please.
I think sometimes people feel that they may turn up to an area and not get the PPE they require as they come into an area. PPE is for everybody, and there should be no limitations for people walking into a clinical area. It should be there available for them to use.
Yeah.
And I think sometimes people feel that they have to take a mask with them because they may not get it at the next clinical area. That should not be happening. Okay, it should be there for everybody to use as they need to.
Okay,
Thank you.
for that.
The next question is, are FFP2 masks useful for anything?
So FFP2 masks, there are two types that are recommended by Public Health England and by the World Health Organisation. FFP3 mask and FFP2. Stop me anybody if I've got this wrong, particularly Chris, who's more of an expert. FFP3 masks are said to give 99%
Yes.
protection against any potential for organism contamination, and FFP2s are 95%.
Yeah.
Both are accredited to
Yes.
be used in COVID positive
Yes.
areas.
Yes.
To date, we have used FFP3
Yeah.
masks,
Yeah.
but FFP2 masks can be used and can
Yes.
be used safely.
Yes.
We have a small stock of those
Yeah.
in the organisation, and we have some through donated through our donation hub as well. And if we think appropriate to use those, depending on our supply lines, we may
Yeah.
consider using those in the future.
Yeah.
I mean, I think where possible, we will continue using the FFP3
P3,
yes.
because we
absolutely.
know that they are slightly
Higher.
Yeah. they're safer, aren't they?
But just
So
to
I think that's
reiterate,
fine,
if we do
Yeah.
deploy the FFP2 masks, they are accredited
Yes,
through
they're
WHO
accredited.
and by Public
Yeah.
Health England
Yes,
for
they are.
clinical use in
Yeah.
COVID positive areas.
It's also probably important to note that we are and have been exploring the reusable masks.
Yeah.
Chris will help me out with the name of those. But we've tried to order many of those, haven't we, Chris?
Yeah, so we've been looking at the ones that most of you remember as the 3M, what I call the quarter respiratory mask, that some people call Darth Vader, because of the little filters on the side. And yes, we are looking at processes that we can decontaminate them in a safe manner for our staff to use.
I think the issue for us that we would buy, the finance is not the issue
No,
here.
No.
It is being able to secure
It's the
supply
stock.
of them when this
Yeah.
is a global pandemic and everybody's competing for the same stock.
Yeah.
And so we are doing everything we can to try and procure those and supplies of those to supplement our disposable stock.
I think that's a really important point as well, Liam, that none of this is financially driven.
No,
No.
not at all.
So we are exploring every avenue for supplies,
Absolutely.
and to some respect, the money isn't an issue as such. We just want to get supplies
Yeah.
in to support and keep our staff safe. It is the supply issue.
It is.
Excellent. So this is in relation to scenario 0. Why are we being asked to use one mask per shift? I've been told to put my mask in my pocket over lunchtime.
Ooh.
Chris, do you want to do that?
Chris, do you want to take that one and we can chip in?
So you shouldn't be putting your mask in your pocket at lunchtime. The mask is only to be worn until it gets damp. After it gets damp, then it does need to be discarded and you will need to do your hand hygiene afterwards. So no, you may require, you should be wearing more than one mask per shift. And obviously if you need to go to the toilet or for a break, again that mask will come off. You do your hand hygiene, and when you come back into your clinical area you would put a new mask on. So no, we would not be expecting you to use one mask for a whole shift.
I think we want masks to be used appropriately. They don't need to be changed every 5 minutes, half an
No.
hour. They can be used safely for
Yes.
the duration of a shift. If they do not become moist or visibly soiled, I think would be the correct thing to
I
say,
agree.
Sue, Chris.
Yeah.
So they need to be used safely. They can be
Yeah.
used to their maximal safe usage time, which can be up to the duration of a clinical session. That
Yeah.
could be 2-3 hours or more,
Yeah.
depending if you're in a clinical area. But if they become moist, this is talking about the standard surgical masks, or if they become visibly soiled, then they should be changed.
Yes.
You shouldn't be carrying them
No,
around.
no.
And this comes back to the reassurance about supply. Is that we are working very hard to make sure that there is all the supply that's needed in the appropriate clinical areas. And so if there is any concerns about not receiving the supply that they need, then feeding that back through to us allows us to just refine our ordering and organising processes, getting the right kit to the right ward in the right time frame, which is absolutely a priority.
Excellent. Okay. Will we be asked to clean the shower caps in between uses?
I don't think so.
They'll be disposable.
We've been able to buy a decent number of them over the past few days, so I don't think that will be necessary.
No.
Yeah. Use them for a shift though, or for a session.
Yeah.
Yeah.
And then the final question that we've had through is it's in relation to something that we've covered already around clarifying wearing own scrubs, which you've already confirmed that is okay to do as long as it's laundered properly.
Yeah.
And we will be accepting donations and sending out the communications on that
Absolutely.
very, very soon.
Okay.
That closes the questions that we've had
Okay. Right. Okay. So, if there's no other questions from you all out there, thank you very much for that. Can I thank all the panel members for answering the questions? Can I just finish by saying there's a number of things you can do to help us at this time. Please, I think to reiterate the messages that you've had from all the panel members today, is using the correct and appropriate use of PPE, following the guidelines that are there on the staff portal, that are there in the clinical areas regarding donning and doffing and safely and using PPE appropriately. That will keep you safe. It will also make sure we use the stocks that we've got as prudently as we can, make sure that we keep enough for everybody when they need them. PPE donations, many of you will get family members and others in your communities saying that they want to donate PPE to us. We welcome donations, but can I just put out a plea that you don't bring them directly into clinical areas and start using them. We do need to make sure they're safe to use, and so there is a hub for doing that. There is an email address which we will make sure that we'll share with you, a donations email address, an Addenbrooke's email address that we will make sure that is, I think it is on the portal already, but we will put that out in comms again today, and so that you know where to direct those donations, so they come through a procurement hub that makes sure that they've been checked before going into clinical use. Again, if apart from donations, any connections or relationships that any of our colleagues online today have with local or regional businesses who want to help with producing any PPE, we'd welcome those and to explore those opportunities. Again, the donation and procurement hub email address will be the right place to direct those. And then finally, if you have any concerns about your PPE, please in the first instance direct them to your line manager that you're working with, and they can escalate those beyond that if this becomes an ongoing issue for that clinical area. We are here to ensure your safety. That is paramount for the organisation. Lorraine, do you want to add anything about that? I think we've said that several times during this morning's session.
Just absolutely, if people feel unsafe in any way, please ask for help. Never worry about asking for help. No. We want you to raise with us any concerns that you might have, whether that's worries about supply of PPE or being able to put it on safely or doff it safely. There are people ready and waiting to help.
Can I add just a couple of things? I think it's really important. So as well as your own local line manager, there's also the emails that have always been in place for all trust employees and freedom to speak up and the raising concerns emails. And I know I and others in this group have replied to a number of concerns that have come through that forum, and very happy to continue to do so. And so I think that's really important for people to be able to access that in other ways. There's a huge amount of resources available around the education and support, and there's more that we can do to help areas if they need and want that. So please come back to us if you think there is more we can do around the education, around the donning, the doffing, the support for using PPE and what that means in each clinical area. And there's a team of people who have spent a huge amount of time learning and teaching and working with groups across the trust, and we're absolutely committed to continuing to do that. Just let us know and we can absolutely come out to support you to do that.
I think one other thing is that, Sue, you're absolutely right. We've had lots of emails in, haven't we, through Freedom to Speak Up Guardians, for example, which have been incredibly useful for us as a team, because we don't know everything that's happening in the organisation. And some of the questions that have been posed to us are things that we've not thought of.
Yeah,
Yeah.
So actually it's been incredibly
Absolutely.
helpful, so please do use that as an avenue.
So, thank you for that, everybody. One final ask: if we hope you found this useful, this session. So please, can you provide any comments on the session through Facebook, and let us know if there's anything else that we could do to improve them. Thank you all once again for everything you're doing for the organisation, for our patients. Keep yourself, your colleagues and your patients safe, and thank you very much, and have a great rest of the day. Thank you. Bye-bye for now.
Bye.